Hi, Dr. Yass here. I'm actually recording now from my brand new, beautiful new facility in Jacksonville, Florida. That's why you'll notice that the background looks different in this recording. In this recording, I want to discuss a particular case that I had recently with a gentleman who was having severe pain around his kneecap, and it was affecting his ability to kneel down, to lean on his knee, and to generally function in terms of weight-bearing activities due to this pain around his kneecap. And I just wanted to point out that he was fortunate enough that he knew somebody and he was able to see me, which is surprising, before going the typical method of seeing an orthopedic surgeon, getting an MRI, finding a structural variation, and simply asserting, since the structural variation is identified at the time of the pain, that it is in fact the cause of the pain. So he was very lucky he didn't follow that path and didn't have to go through that process of being scared into submission to get a cortisone shot or possibly getting a surgery he didn't need. But I wanted to discuss the uniqueness of his circumstance, because it turned out that based on a Yass Method evaluation, that the cause of his pain around his kneecap actually related to weakness of a muscle in the hip region. And for most people, this is a tough thing for them to wrap their head around. And it's primarily because the medical system, the medical establishment, seems to gravitate towards the idea that if you're having pain at your knee, the cause must be at the knee. The Yass Method, on the other hand, has shown that in greater than 99% of cases, if you're having pain at the knee joint, the cause is somewhere outside of the knee joint. And this is a classic one of those cases. So what this guy told me was, again, going to the idea that if he tries to bend, kneel, anything that really bends his knee leads to the pain around the kneecap. And so once he talked about the pain being around the kneecap in an area known as the patellofemoral joint, which is separate and distinct from the joint between the thigh bone and lower leg bone, which is where the meniscus and most cases of identified arthritis exist, we recognize that the joint between the kneecap and the thigh bone is really primarily controlled by the thigh muscle, the front thigh muscle known as the quadriceps muscle. And that is because the quadriceps muscle is attached to the kneecap and allows you to straighten and bend your knee and controls the tracking of the kneecap through the knee joint when the joint is moved or when force is being applied to the knee joint, like with weight bearing. So typically, if you're going to have pain around your kneecap, there's some relationship between the strength of the thigh bone, the front thigh muscle, the quad, and the posterior thigh muscle, the hamstring. And somehow an imbalance can develop, or so the quad, it becomes too strong, or the quad can strain and there's decreased force on the kneecap, and that affects the tracking of the kneecap. So I initially evaluated him for these situations, and it turns out that the affected sides, quad strength and quad flexibility and hamstring strength and hamstring flexibility, was basically about the same as the unaffected side. Well, if those forces and flexibility presentations are about the same, and he's having pain on the left side and not on the right side, it basically teaches you to eliminate those issues as the potential cause of pain. Because if they're roughly the same on both sides and yet he's having symptoms on one, how could it possibly be causing those symptoms? It can't. So that eliminated the quadricep, the front thigh muscle, and its relationship to the hamstring in terms of being a cause of the pain around the kneecap, which led me to another possible muscular cause, and that is that the IT band that many people have heard about and are familiar with, which oftentimes can cause pain at the lateral aspect, the outer thigh. Most people don't realize it's actually attached to the kneecap. So if the IT band were to strain and shorten, it can pull the kneecap laterally to the side. And instead of having the kneecap run directly through the groove between the outer boundaries of the knee joint, it could actually pull it to the side and make it rub against the outer boundary, which would become highly irritated and painful as the knee is bent. Well, the IT band has a muscle at the top called the tensor fascia lata, and that's typically only going to strain if another muscle that sits on the side of the pelvis, called the gluteus medius muscle, were to strain first. Well, the gluteus medius muscle is responsible for creating balance and stability when single leg standing. So if the gluteus medius was to strain due to an inability to create balance and stability, the tensor fascia lata, the muscle that sits on top of the ITB, would try to compensate. It's not designed to do that level of work, so it can strain, cause the ITB to shorten, and then pull the kneecap laterally. So what I did was I asked this gentleman to single leg stand on the unaffected leg, and then to stand on the affected leg. And shockingly, just by asking him to single leg stand on the affected leg, he instantly said, there's his knee pain. So single leg standing, and you could see he was wobbling, he was having some difficulty, clearly showed that there was some relationship between the pain at the kneecap and balance and stability and the ability to achieve it. Then I took it to the next level and I said, well, can you single leg stand and then bend your knee, single leg squat 3 times? So we did it on the unaffected leg, no problem. He goes to do it on the affected leg and actually incites the pain to become much worse. And more importantly, as he's bending down, you can see that his knee is not staying directly over the foot as he's squatting down. It's actually caving in, which is a representation of a weak gluteus medius muscle. And so if as he kneels down, his knee caves in, that's going to lead the kneecap to move more towards the lateral border of the knee joint and impinge upon that lateral border, inciting the pain. So the presentation of the knee caving in when he single leg squatted, as well as inciting the pain, reinforced that we had actually identified the mechanism and the cause of the pain when he bends down, which basically was a weak gluteus medius muscle. So to continue further reinforcing the point, I then muscle tested the unaffected side's gluteus medius and then the affected side's gluteus medius, and it was weak as all hell. He had no force output on the affected side's gluteus medius when I muscle tested it. Then I pressed into it, and there was massive knotting and tremendous pain, which he had never recognized was there. So treatment then was provided, doing massage of the gluteus medius, massage of the ITB, stretching the ITB, then strengthening the gluteus medius muscle and strengthening other muscles that work in conjunction with it. And after about an hour's treatment, he was able to then bend down. And it was very exciting to see that the knee no longer caved in when he would single leg squat. He actually was able to keep his knee directly over his foot. And because of that, the kneecap tracked appropriately. And the level of pain basically was diminished almost completely. He had a little bit of soreness left, but nowhere level of pain as he had prior to the treatment. And this showed that not only had we been able to identify the cause of the pain at the kneecap as being related to a strained gluteus medius hip muscle, which then led to a shortened ITB, but in treating it, we were able to reduce the symptom almost to nothing in one treatment. So here you have a case where a person had pain at the kneecap being caused by a muscular deficit at the hip. And I just presented the techniques used in a Yass Method evaluation to help understand that exact mechanism. Without getting a Yass Method evaluation, which includes the aspect of the history as well as the physical tests that are performed to identify the tissue in distress. And when muscular, which muscles are responsible, you're not going to come to this conclusion. If you went for physical therapy for pain around the kneecap joint, they might do taping. They might tell you you need to strengthen something called the vasta medialis oblique and quad muscle, which has nothing to do with the proper tracking. And you would be left with the same pain. If you had gotten surgery for a meniscal tear or arthritis that happened to be identified at the time that this guy was having his pain around his kneecap, that would have done nothing to resolve his pain. And he'd still have the pain, maybe more pain because there'd be post-surgical swelling and pain from the surgery, which would have led to greater difficulty achieving balance and stability and weakened his glute med even further. That's why you need the Yass method to properly get diagnosed. Without the proper diagnosis, you will not get the proper treatment. In more than 98% of cases, the cause of pain is muscular. You have to know which muscles are responsible and then be able to utilize the exacting exercises utilizing progressive resistance to get the appropriate muscle strong enough so the force output is greater than the force requirement of the activity, which then allows for pain-free full function. We were able to achieve that almost there, just short of it, in one visit with this guy. He was blown away by the results. The great news, he's now empowered to understand what's causing his pain and how to resolve it through the appropriate exercise and the use of progressive resistance, to where very shortly he will be pain-free. And he will remain pain-free, and he will be able to bend and twist and do anything he wants, weight-bearing, bending on that knee without any difficulty, because he's in control. And that's what the Yass method gives you. So here is, again, another indication where, as I've said before, in more than 99% of cases, the cause of pain is not where the pain is being experienced. If you find this video helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, and you'd like to subscribe, please hit the subscribe button and the little bell icon so that you can get notification when new videos are added or when I'm live on YouTube. If you want to get in contact with me, maybe you're having some issues and you'd like to discuss it with me, you can contact me by email at drmitch@mitchellyass.com. Or if you'd like to make an appointment, and the great news is I can say either in person in my Jacksonville office or by Zoom, you could go to my website, livewithoutpains.com. You can see what the sessions are like and what you can expect, and then pick a day and time, whether for your in-person session or your Zoom session that works best for you. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.